nursing is a hands-on profession. How do you provide hands-on experience for a large cohort of nurses? Well, the only way to do that is to use technology.
Simulation is our answer to help with replacement of clinical hours. We can recreate clinical situations that students may not have access to within the hospital setting. VR clinicals helps the student actually transfer their knowledge from classroom to clinical practice, and it gives them a mirrored experience of what they may have in real clinical practice.
VR Clinicals allows us to control the level of patient care, but more importantly, not only it helps students prepare for their clinical skills, it helps them prepare for their professional skills.